final lab of the season, and appreciate you guys in my class. It's been a pleasure. So now, what we're gonna do? Go through all the blood vessels. We might split it into like the cranial blood vessels, abdominal blood vessels, and the caudal blood vessels, so that the video is not too long. Okay. I'll start with the veins because those ones are very visible compared to the arteries. Okay. And not in the exam, my good friends. The way I split it into cranial veins, cranial blood vessels. So I'll pick the arteries and the veins and so forth. So you just have to be able to do that. Must always say vein or artery. And in the caudal section, if it's both vein and artery and vein, then you would say artery and vein, okay? Please, so that you get the points. Okay, so what would this be? This one that goes across, this blue one? Yeah, transverse jugular vein. That's good. Thanks, Chelsea. Okay. And what is this one here? Up going to the front of the face. It's going to the front of the face. So it's gonna be the other one. Anterior facial vein. Okay. And then this one, my good friend Chelsea is going back. This will be the posterior one. Okay, facial vein. What about this one that goes down here? This big blue one here. Do you see this on the side that goes along the trachea? Yes, external jugular vein. Thanks, Lynette. You see this branch here that goes to the trapezius muscle. Over here, you can see the blue one, and even the red one is slightly on there. What would this be from the jugular vein? If you use the board, you can use it too. Well, not the one inside, because this one doesn't have it, but there's one that is a branch of the external jugular vein that supplies the trapezius muscle. What would that be? And it's on the board there. Mm-hmm. Scapular vein, that would be correct. Transverse scapular vein. Bing, bum, bing, bum, bing, bum, bing. What about this one here? This one that forms a V like that. Yeah, brachiocephalic vein. Okay, so in this exam, I'm gonna give you a one-pager spelling sheet. So if you don't spell it correctly, you don't get any credit at all, because I've given you the sheet. You see what I'm saying? I've given you the sheet of paper with most of the spelling. So it's good to learn to spell most of it, and then the hard ones, those are the ones you look up. That way you don't get confused and you're not flustered in the exam. Is that cool, my good friends? Mm-hmm. Yes. Bing. Ooh, looky here. Oh my God. So this one here, I know it's not as well infused as it could possibly be, but looky here. What is this one here coming directly out of this curving one right here? What is this? Is the red one? It's not appearing as red as it should, but you could just work with this. This one is coming from the one that acts like this to the left side, and is the first branch on it. This one, this big one, this red one. I know it doesn't look as red as it should. This one, you can look at the arteries. Starts with a B. If this, yeah, brachiocephalic trunk. Why? Because it's gonna split into this. Look here. One, it's gonna split into this one, which is the brachiocephalic trunk splits into this one that goes to the head. So this will be the one that supplies the head, the artery that goes to the head. It starts with a C and it's 3 words. Yeah, common carotid artery. Do you see the branch coming out of the brachiocephalic trunk? Do you see it over on the board? So this is it. Okay. And then this one here, you see how the brachiocephalic trunk here splits into this on the left side, the common carotid artery. Then there's this sort of thicker branch that goes. Do you see it? This one is a different configuration. And like I say, you must always expect that it's not going to be exactly as you learnt it in the anatomy class, okay? So this one is a split to this blood vessel here, which supplies the right upper limb. What is that? This one. Starts with an S. No, it starts with an R because it's on the right. Right subclavian artery. Do you see my good friend? It's the only blood vessel in here that you're gonna say right and left. My nose is itchy. And I can't even great. What's that? It's the cat juice. The cat kind of makes my nose kind of run and itch and stuff. I don't know if I have an allergy. My God, I work with cats. So this is the right subclavian artery. Okay, and then this one is the other one that goes to the head on the right side, which will be the. Well, it's on the right, but it's still branching from the brachiocephalic trunk. This will be the right common carotid, but for this one, because they're coming from the brachiocephalic trunk, you just say common carotid artery, right? So this is common carotid artery, and this is the common carotid artery on the other side, okay, on the left side, okay? And then this one here is the right subclavian, which comes here. I'm afraid it's not as well infused as I would like. You see, what I was saying is you always find with blood vessels, the neurovascular bundle. You see what I'm saying? These little itty bitty things are nerves. You see all these? These are nerves. They all go to run together. You see what I'm saying? Okay? So, if this is the brachiocephalic vein, what is this? And this is the external jugular vein, what would this be? On the blue part, this one here, you see, the external jugular vein, brachiocephalic vein, and this one here, which branches to supply the upper limb, on the blue part would be the subclavian vein. Yes, the subclavian vein comes down here, okay, and here it's not showing nicely, but you see the split, it kind of comes early, and this cat seems to have like a different configuration, you know, but over here, if this is the subclavian vein, what is this one here? That is going to, the scapula is right there. See, there's the scapula. What is this one? That supplies the subscapularis muscle. It's this one. Did I say record? Oh, okay, I did. You see this one? Oh, it's supplying the subscapularis, the muscle. That is subscapular vein, yes. Yeah. Subscapular vein, yeah. Don't confuse it with this one, which is the transverse scapular vein, okay? Okay, subscapular vein. Once you get this branch from the subclavian, then you get this subscapular vein, then it continues now towards the armpit as the axillary vein. Because the armpits are axillar. You see what I'm saying? So that's why it's called the axillary vein. So once it goes to the armpit, and it goes to the armpit, oh my God. And in the exam, I'll make it very obvious, you know what I'm saying? Because I like you guys. I do. Of course, because I hook you up like that. You see? You see, there's the armpit or leg pit, if you will. So, this is axillary leg pit, you know. I don't know if there's the armpits. Okay, so there you go. So, my arrow would be like somewhere here, and I'll be like this. What would this be? It's supplying the arm, and the arm starts with a B. Brachial artery. Vein is because it's blue. Okay, blue is for vein, red is for arteries. So you must always do that, okay? And so the kind of mistakes you make now, those are the kind of mistakes you look out for in the actual exam. You see what I'm saying? So you must always like say to yourself, repeat to yourself that blue, I'm going to have to end with a vein. If it's a red one, I'm going to have to end with an artery. You see what I'm saying? And if it's yellow, in here, which we're going to see in a little bit, then it's a portal blood vessel. But those portal blood vessels are still veins. You see what I'm saying? So you're going to end yellow and blue, you end with the vein. Whatever answer you put, yes, red is artery, and then you're done. Okay. See what I'm saying? The only thing is the yellow ones are the portal blood vessels. Okay, those are the ones I was saying. They're not well infused in the bless you. Yes, yes, yes. See what I'm saying? Do you see those neurovascular bundle? You see? Do you see all this? What is this? This is a part of the brachial plexus, correct? Remember when we were talking about the spermatic cord, and I was saying you've got the pampiniform plexus, which is the vein going back, and you got the artery. So then what else is going to be inside of the spermatic cord? And I was saying pain you can feel when somebody squishes your testes, and it's got to be conducted by nerve. So those will be the structures inside of the spermatic cord. Just like you see here, it's the same arrangement. You always find blood vessel, a vein and an artery, and the nerve. Always like that. They go as a neurovascular bundle. Okay? So anyway, I'm just trying to hook you up with both lecture and lab at the same time. Okay? And what is this? This blue one here, this big blue one that coming out into the right atrium. See the brachiocephalic veins join like this to form there. It's not, that's the easy one actually. Yeah, superior vena cava. And remember, this time I want you to say superior vena cava or inferior vena cava because it's right there, okay? Don't just say vena cava because then that's half a point. Okay? Please. Because this is the superior vena cava. And then this one goes to the breast. What is this? Yeah, internal mammary vein. If it's blue, you say vein with confidence. Okay? If anything, because you know it's going to be a vein. Okay? So internal mammary vein. Okay? My good friends. Oh my God, looky here. So I wish I had like 4 hands and stuff. So I could hold stuff. But I only have 2. So this one here, that drains the lungs, what would this be? That goes into the superior vena cava just before it enters the right atrium. What is that? Starts with an A. And it's on the board right there if you want. Azygos. See, that's Azygos. Azygos vein. And all these things are coming in the exam, I'm telling you. You know, you don't have to worry about it. All these things are coming. Okay? So, yeah. So you don't have to think any, many, many more. Okay? It's coming. If we talk about it in here, most likely it's coming because it's going to be 50 blood vessels you're going to have to identify. Mm-hmm.
So 1 minute each?
Huh?
For 1 minute each?
Yeah, 1 minute each. So it's going to be 50 minutes. That's why it's 11:30 to 12:30. You see what I'm saying? It's on Tuesday. Mm-hmm.
Tuesday after?
11:30 to 12:30.
Okay.
Yeah. Okay. And if you... No, in Zoom.
Oh.
This is a lab. So what is this? It's below. If this is the superior vena cava, what is this?
Inferior vena cava.
Yes, inferior vena cava. Thank you, thank you. Okay, my good friends. Now I have to fish this one. It's coming from this aortic arc. Okay, so this is the aorta. Okay, and like I said in the exam, you don't have to say aortic arc. If you do that, it's okay. But if you say aorta, I'll still take it. So I'm gonna put it as one of the answers. You know, aortic arc, aorta. You know, so yeah, so you get credit for it. What about this branch there that comes from the aortic arc? This one right here. What is that? It's the only other branch after the brachiocephalic trunk. No, it's coming from the brachiocephalic, from the aorta, from the aortic arc. If you're looking at the arteries, look at the arteries deal, the arteries, cranial arteries. What's after the brachiocephalic trunk? What's that one with the green from Maria right there? Yes, left subclavian artery. That's the only one you have to say left and right, right? See, the right subclavian artery is a branch from the brachiocephalic trunk, correct? The left subclavian artery is a branch from the aortic arc, correct? So that's why you have to say left and right, because they're branching differently. You see what I'm saying? You see how this one here, this is the brachiocephalic vein, this is the brachiocephalic vein. I mean, you don't have to say left and right. Why? Because they're both from the superior vena cava. See what I'm saying? That's how it works. So don't be like saying left and right for everything to cover your behind. No, don't do that, because then it will be wrong. You see what I'm saying? Because the answer on it will be left subclavian. Only this will include the left. Okay, the left subclavian artery and the right subclavian artery. Those are the only ones because they branch differently. Everything else is branching from the same blood vessel, so it's just gonna be that name. Okay, and that's it. Okay. So, okay, I think I will rest my case with this, and then we did the subscapular, and then we did the axillary and stuff like that, and the transverse scapular. Oh, okay, so here, okay, on the left subclavian, if you can see here, so this will be thyrocervical. Usually it goes up alongside this external jugular vein. You know what I'm saying? Oh, there it is. Being, do you see it? Oh my God, it's not as pronounced as I would like, but it's there. But in the pictures for the exam, it's gonna be really nice and prominent. Oh, you're here, Alex. I mean, thank you for coming, man. Oh, okay, you see what I'm saying? So this will be the thyrocervical artery. Okay, do you see that? The thyrocervical is one of the 4 branches from the subclavian artery. Do you see what I'm saying? And you could even see here, there's this one here, which is the vertebral artery right here. Do you see it? You see? There's this first one, the vertebral artery. It's going to go through the transverse process foramen going up there. You see what I'm saying? And then this is the thyrocervical. You see, that runs alongside the external jugular vein. You see, there it is right there. I'm going to pry it out. Bing, bing, bing. You see this one? From the film. Okay? So that's the one I wanted to do, the thyrocervical artery. Okay? So I'm going to switch it off. My good friend...